Hello everyone, myself Ruchita from Sri Venkateshwara College of Engineering, studying in 4th in CEC. Today I'm here to discuss about the heart-related diseases. The table of contents we're going to discuss today are about the disease, diagnosis for the disease, treatment for the disease, and engineering techniques that are involved in curing the diseases or knowing about the disease. Introduction. Heart is the main organ of the cardiovascular system, which helps in double circulation. That is, the blood circulates twice in the heart in one cycle and helps in pumping the blood throughout the body. It also works with other body systems to control the heart rate and blood pressure. The heart is a full-size organ that contains four main sections made up of muscles powered by electrical impulses. Brain and nervous system direct the heart function. Let's know about the diseases. What causes heart disease? How can a person have a heart disease? The most important factors of having a heart disease and stroke are a person maintaining a unhealthy diet, lack of physical activities, tobacco use, and harmful use of alcohol. These are the factors which causes the heart disease. Not only this, even if a person has a raised blood pressure, raised blood glucose, raised blood lipids, and overweight and obesity, this also causes the heart diseases. Let's know the types of heart diseases. They are heart attack, heart failure, heart disease, stroke, heart rhythm disorder, peripheral artery and vein disease. Let's know how a heart attack occurs. When the heart attack occurs, a coronary artery is completely blocked, cutting off blood flow, where the blood cannot be flowed to the heart muscles, which causes heart attack. To promote medical attention is crucial during the heart attack to minimize damage to the heart. Heart failure. Heart failure is a condition where the heart cannot pump the blood efficiently, lead to fluid buildup in the lung and other tissues. Hypertension, that is high blood pressure. High blood pressure puts extra strain in the heart and blood vessels, increasing the risk of heart disease and stroke. Stroke, that is nothing but the brain. A stroke occurs when the blood flow to the brain is interrupted, leading to the brain damage or neurological defects. What are the signs of a heart attack? How will a person experience a heart attack? What are the signs he may experience if he gets a disease? Mainly chest pain, chest tightness, chest pressure, chest discomfort, shortness of the breath, pain in the neck, jaw, throat, upper belly area, or the back. Pain, numbness, weakness, or coldness in the legs or arms. The blood vessels in those body areas are narrowed. Coronary artery diseases (CAD). It is the most common heart problem. With CAD, you may get blockages in your coronary arteries. The image shown that you can see there is a fatty deposit on the arteries where this avoids the flow of blood. The vessels that supply blood to the heart that can lead to decrease in the flow of blood to the heart muscles, keeping it from getting the oxygen it needs. Coronary heart diseases can give you a pain in your chest or it can also lead to an heart attack. Some things that put you at higher risk of coronary artery diseases are age. For men, the risk of heart disease goes up after the age of 45, and for women, the risk raises after menopause. Having diabetes or metabolic syndrome. Even family history of coronary disease can also cause a coronary artery disease. Genetics, high blood pressure, obesity, smoking, and stress. These are all the things which may cause coronary artery diseases. The types of coronary artery diseases are obstructive coronary artery disease, spontaneous coronary artery disease, dissection, and non-obstructive coronary artery disease. Let's know about obstructive coronary artery disease. This type occurs when a fatty substance called plaque builds up upon the coronary arteries, leading to artery narrowing. It is most common type of coronary heart disease. Spontaneous coronary artery dissection (SCAD). A sudden tear in the coronary artery wall blocks the blood flow to the heart. CSAD causes sudden symptoms that often present as a heart attack. Non-obstructive coronary artery diseases. There's no plaque buildup in the coronary arteries. Instead, narrowing in the coronary arteries is caused by other complications including irregular constriction, coronary vasospasms, heart tissues that compresses the coronary arteries, myocardial bridging, or damaging into the artery lining, endothelial dysfunction. Diagnosis. How is heart disease treated? 2. Coronary angiography. Using X-ray scans and contrast diet to view how blood flows through the coronary arteries. Coronary artery calcium scan. Using a CT scan to assess the coronary arteries for calcium or platelet buildup. Echocardiogram to view the heart structure. Electrocardiogram to measure the electrical activity in the heart. Heart CT scan using X-ray and specialized computers to create pictures of the heart. Electron beam computed tomography (EBCT) using an electron gun to scan the chest and check for calcium buildup in the lining of the coronary arteries. Exercise stress test to evaluate how the heart functions during exercise or while taking medication that mimic the effects of the exercise. Intravascular ultrasound to see inside the coronary artery walls, pinpoint plaque and plan the treatment. Nuclear stress test injecting a small safe amount of radioactive material into the bloodstream to see how well blood flows to the heart at rest and during exercise. The treatments. The treatment for the heart disease are the person with the heart disease has to change in the lifestyle to improve the heart health. Medications to control blood pressure, cholesterol, and heart function. Invasive procedures such as angioplasty or stent replacement to open the blocked arteries. With stent replacement, the arteries which is blocked is replaced by a stent or which clears the blockage and helps in the blood flow. And the surgical interventions like bypass surgeries or fat replacement can be done or having maintaining the heart health. The engineering techniques involved in the heart diseases are medical imaging, minimal invasive procedures, biomedical sensors, artificial heart and heart assist devices, tissue engineering, and generative medicine. Let's know about medical imaging. Imaging. Engineers have developed advanced medical imaging techniques such as MRI, magnetic resonance imaging, CT, computed tomography, and ultrasound, which helps in diagnosing heart condition and guiding surgical interventions. Minimal invasive procedures. Engineers help develop minimal invasive techniques like angioplasty and stent replacement that treat coronary artery diseases without the need of open heart surgery, reducing recovery time and complications. Without any complication, a person can cure his heart disease by doing angioplasty or stent replacement. Biomedical sensors. Engineers have developed various sensors to monitor heart health, including the wearable devices. Nowadays, there are watches which can track the heart rate and the blood pressures and other vital signs, which provides a valuable data for managing cardiovascular conditions. This is how engineers have worked in the medical field. Artificial heart and heart assist devices. The designing of artificial heart and heart assist devices. That is, a person can use the artificial heart or heart assist devices till there is a transplant to replace the function of the failing heart while a patient awaits. Still, as he waits for the transplant, he can use the artificial heart or heart assist devices. Tissue engineering and regenerative medicine. It involves developing a new tissue and organ using cell and biomaterials. This holds promise for repairing damaged heart tissue in the future. Finally, coming to the conclusion, heart is a very vital organ in the human body, so it is very important to maintain a good heart health. Without heart, there is no pumping of blood and there is no exchange of oxygen and carbon dioxide. So, everyone, please do maintain your heart. So, the significant concern it is heart-related disease is a significant concern worldwide that with awareness and protective measures, many of the condition can be prevented or managed effectively. We have to maintain a good physical health and a person with a heart disease should not use any tobacco or alcohol which will maintain a good heart health. Let's prioritize our cardiovascular health and take steps to lead a heart healthy lives. Thank you.